Okay, I think, yes, if we can just recap this, it's just, I think Beth did touch on this earlier, but just in case you weren't here, that obviously nothing that I discuss will constitute as medical advice. This is a mixed meeting of patients and professionals, and we are all here to learn from each other. I appreciate that there will be people on the call who've got and had very frustrating experiences. And there will be some doctors here, but please don't shout at them, I think is please don't take your frustrations out on our doctors.
Yeah, that's what I was going at.
I think that's what you were trying to say. But that does not mean don't share your story with us, because, you know, we do want to hear your stories. Everything that you've experienced is really important to us, and we will learn from it. Some of the talks that you'll hear today will be about research that will be at the early stages. And as Beth has already said, we are recording this, and she will edit it and hopefully get it up on the YouTube channel later on this week. If you don't want to be included, please just let Beth know. Next slide, please, Beth. Okay, so how much information is the right amount? And everybody is different, and there is a lot of information out there at the moment. So when you're bombarded with so much information, it can cause extra worry and confusion. The term for this is toxic information. And some people absolutely love all this information. And the more they can read, the more they can learn about it, the more empowered they feel. You know, knowledge is power, and that really is important for a lot of people. But there are also people who just don't want to know. You know, they literally, what is wrong with me? What treatment do I need? Give me the treatment. Am I feeling better? Brilliant. And that's all that they need to know. I mean, I was talking to Beth yesterday, and my mother-in-law is a classic example. I mean, she's 78, and all she ever wants to know from her doctor is if she's dying. And with every illness that she gets, that's all she wants to know. She's literally not bothered what's wrong with her, as long as she's getting the right treatment and she's not dying. But we wanted to know from our patients, you know, what do you want to know? Next slide, please, Beth. So obviously risk genes is something that we don't talk about very often, and that's the whole purpose of today. It's a new area. It was certainly a new area for me when I started looking at it. And from a chronic aspergillosis point of view, that is not thought to have a large genetic component, because, as we know, it usually follows on from another respiratory condition. Most of our patients will have asthma, COPD, bronchiectasis, cystic fibrosis. They may have had TB in the past, and that damages the lungs and allows Aspergillus in and allows it to grow. Genomic technologies are revealing genes that increase this risk by a small amount. So what Beth asked me is this information useful to patients, or is it likely to cause them unnecessary worry? So here is just a list of questions that I asked. How happy are you with your level of understanding and why you developed aspergillosis? Can we go on to the next slide, Beth, and then I'll be able to give one of the answers that I got. So this patient said, I have no idea how I developed it. I had a scope, and my doctor's response was, you had a lot of fungus in there, with a surprised tone. It was later found to be Aspergillus. I got responses from about 10 different patients, and 9 of those patients said, I had no idea how I developed it. My understanding is really poor of why I got it. So I think that is quite shocking for me, but also I asked them, if you could, would you want to know why you got it? And they all said yes. So I think there is this need in people to want to understand why they have got it. Next slide, please. So the second question that I asked was, do you ever worry about your children inheriting aspergillosis? And if so, does it bother you a little or a lot? My son had childhood asthma and it's looking like his kids might too, so I'm very concerned. So Stephanie replied that, and I asked Stephanie, did she have childhood asthma? And she did. So obviously the asthma is running through the family, and she has now developed Aspergillosis. I think she's got ABPA. And so she's obviously quite justifiably concerned. We also had another patient who actually explained that she had it, but so did her dad. So she is the child of that. So again, that's looking like, do we inherit it? I don't know. I don't know the answer to this question. I'm hoping that somebody today will be able to provide that answer, but it's definitely something worth exploring. Next slide, please, Beth. There you go. So that was Alison. Yes, I am worried. My dad had it, so I wonder if I inherited the risk at least. Alison also has ABPA. Next slide, please. Would it help your peace of mind to know whether or not you have an aspergillosis risk gene? Everybody said yes to this. I would, oh no, sorry, that's question 4. But question 3, everybody to question 3 said yes, that it would help their peace of mind to know whether or not that they had an aspergillosis risk gene. Question 4, if you found out you had the risk gene, how much help would you need in understanding what that means for you? And Jan said, I would definitely need help understanding it for sure. And I think that that was this universal across the board. We did have a couple of people in the group who are very knowledgeable. One has a medical background. So obviously their understanding of it is more advanced than, say, for myself, myself and patients who literally came to this disease with no medical knowledge whatsoever. Next slide, please. So the question was, where would you look for more information about genetics? And Marcella, who's on the call today, I've just quoted her here, she says, I don't know where, I need to know more about it. And there's a mixed response to this. There was a handful of people who had no idea about where to look. And I think it's one of the reasons why we're here today, to help them and guide them about where to look. But a lot of people did say that they would look on the National Aspergillosis Centre website to try to find help. They would Google, they would go onto Google and have a look. And there's also people who said that they would reach out, for example, to the charity to see if we had any information on our website as well. So there are people out there who know that we're here. They know there's information available. It's just up to us to make sure that we've got the information there for them to access. Next slide, please, Beth. So what do people want to know about resistance genes? Well, we know there's an awful lot of information out there about antimicrobial, antifungal resistance. But what do we know about the genes? Well, it may mean that obviously resistance means that if we have a gene that is resistant to antifungals, it means that that medication no longer works, it's no longer effective, and patients may need to switch to a different antifungal or come off treatment altogether. And I've got a lot of patient stories, some of which will be being shared this afternoon, about patients who this has happened to. And it's not necessarily that they've become resistant to the antifungal, but for a lot of our patients, they need to switch to a different antifungal because it's either not working or they just cannot tolerate the medication itself. Resistant genes tend to evolve in people who have been on azoles for many, many years, but obviously we know that there are some strains in the environment that are already resistant before we've actually even inhaled them. So we asked our patients, is antifungal resistance something you ever worry about? Do you know how or whether your doctor is monitoring this? Next slide, please, Beth. So Jan answered this question along with the second one, but my doctor recently ordered tests, but at my request, and it was the first time in 5 years. I am not able to tolerate antifungal medication due to heart failure symptoms. and would love ideas on alternative treatments. My inability to take antifungals has made treating this much more difficult. We didn't find any patients who were able to come back to us to say, I have developed resistance to an antifungal or to all antifungal, to all azoles. We have had a patient in the past, but we know that she's no longer with us. And we also do have a patient in America, but I've not been able to contact her. But every other patient came back to say, I'm not aware that I developed resistance to it, but I wasn't able to continue to take it due to side effects, or the fact that it just wasn't working. So they had to switch me to a different one. Next slide, please. Okay, so same question. Is antifungal resistance something you ever worry about? Absolutely. Do you know how or whether your doctor is monitoring this? No monitoring. But I do plan to discuss this again at my next doctor visit. And this was the same across all the patients. Everybody was worried about it, but nobody was aware of whether or not they were being monitored. And some of them are going to ask their doctor. Next question. Okay, so this question was, there is currently a lot of scientific data around whether using antifungals in agriculture is producing resistance in the Aspergillus strains that infect people. Do you think that patients should be involved in this discussion? Yes, was the consensus. And this was Stephanie's answer. Indeed, both patients, those susceptible, and farmers who are often affected too. And that was across the board. Everybody answered yes to that question. So we want to be, it's very clear that patients want to be involved in the discussions around this, and how it impacts, you know, the whole world. One health, I guess, is the tagline to that. Next slide, please, Beth. PCRs. I think Beth said before, everybody knows what PCRs are because of COVID, but interestingly, we had quite a few patients who didn't know what a PCR was. An aspergillosis PCR is a relatively new test, which might be one of the reasons why. That detects fungal DNA in a sample. NAC uses it to test sputum or the fluid that is collected during a bronchoscopy, a bowel. Have you heard of a PCR? Next slide, please. Have not heard of a PCR, and I have not had the test. I am interested in anything that helps me understand this lung condition better and helps me manage it more effectively. I think my question here would be, would we know if we'd had the PCR test? When we provide a sputum sample, do we know what happens to it when it goes to the lab? I mean, I certainly always had the impression that it's going to sit in a Petri dish somewhere and someone's going to grow things off it, potentially aspergillosis or any other form of bacteria. But would I have known that? I mean, I am a patient at NAC, so potentially my sputum heads to a PCR test. I have had a report from a doctor, which I did discuss with Graham and Beth, where a doctor said to me, we detected live DNA for Aspergillus. I didn't know what that meant. Apparently it doesn't mean anything.
Yeah, I didn't know what it meant either. Live DNA, what? And that's toxic information, because you were left wondering, what is that bad?
I mean, at the time I was really poorly, so I didn't actually question the doctor too. But afterwards I thought, what did he say to me about live DNA? But anyway, they have it, and I'm an experienced patient. Next slide, please. Yeah. And then Stephanie, literally, I have no awareness of what you're talking about. I don't know what a PCR is. I don't think I've ever had one. Nobody's ever discussed any of the results. So I don't know how they work. So, I mean, we are saying that it's relatively new, and it's clear that there's not an awful lot of information out there about it. Next slide, please, Beth. And Alison, who won't mind me telling you is a retired pharmacist, had a bit more knowledge on it. So she said, yes, I know what a PCR is. No, I've never heard of the aspergillosis PCR. I did not know one was available, unless they used it when I had a bronchoscopy, and that may well be the case. And question 11, which is, do you understand how the test works and what it looks for? If not, do you want to, or would you prefer your doctor just tell you that aspergillosis has been found? And she says, I understand the basics, but I would just be happy to get the results, I think. And I mean, that would be me as well. I don't necessarily need to know everything about it, just what they found.